What do Pap smear results mean for follow-up procedures? Imagine going for a routine checkup and getting your Pap smear results back. What do those results really tell you about your cervical health and what steps might come next? Let's break it down in a way that's easy to understand and backed by solid medical guidelines. If your Pap smear results are normal, that's great news. It means no abnormal cells were found, and your cervix appears healthy. Usually, you won't need any immediate follow-up beyond your routine screening, which is typically recommended every 3 to 5 years depending on your age and the screening method used. Of course, if you develop symptoms like unusual bleeding or pain, your doctor might want to check further. Sometimes, the sample collected isn't sufficient or clear enough for an accurate reading. This is called an unsatisfactory result. It might happen if there's too much blood, mucus, or if the sample was not collected properly. In this case, your healthcare provider will usually ask you to repeat the Pap smear within 2 to 4 months to get a better sample and ensure accurate results. When your results come back abnormal, it doesn't mean you have cancer. It simply indicates that some cervical cells look different from normal. These changes are classified based on how severe they are. The most common abnormal result is called atypical squamous cells of undetermined significance, or ASCUS. This often suggests an infection with human papillomavirus, or HPV, which is common. Your doctor might recommend HPV testing to see if high-risk types are present. If the HPV test is positive, more detailed follow-up like a colposcopy may be needed. If negative, you might just continue routine screening. Low-grade abnormalities, called low-grade squamous intraepithelial lesions, or LSIL, usually indicate mild changes often caused by HPV. These often resolve on their own, so your doctor might suggest repeating the Pap test or HPV testing in about a year to see if the cells improve. More serious abnormalities, known as high-grade squamous intraepithelial lesions, or HSIL, suggest a higher risk of precancer or cancer. For these results, your healthcare provider will likely recommend a colposcopy, which is a detailed examination of your cervix using a special magnifying instrument. During this procedure, small tissue samples called biopsies may be taken to determine the extent of abnormal cells. There's also a category called atypical squamous cells that cannot exclude HSIL, or ASCH. This indicates suspicious changes that need further investigation, usually with colposcopy. Glandular cell abnormalities, called atypical glandular cells, or AGC, involve cells lining the cervical canal or uterus. These findings often requiring more comprehensive evaluation, including colposcopy and possibly sampling of the endocervix or endometrium, to rule out precancer or cancer. Many Pap smears are now combined with HPV testing, known as coat testing. If the HPV test is positive for high-risk types, your doctor will likely recommend closer monitoring or a colposcopy. If the HPV test is negative, the intervals between screenings can be safely extended, often up to 5 years. Follow-up procedures depend on your specific results and overall risk. Minor abnormalities might just need repeat Pap or HPV testing in 6 to 12 months. Moderate to severe abnormalities, usually requiring a colposcopy to get a closer look at your cervix. If precancerous changes are confirmed, treatments like removing abnormal tissue may be recommended to prevent progression to cancer. Guidelines now emphasize a risk-based approach, considering your past screening history and current results. This helps ensure early detection while avoiding unnecessary procedures. Remember, procedures like colposcopy and biopsies can cause some discomfort and anxiety, but they are important tools in catching problems early and protecting your health. In summary, your Pap smear results guide the next steps in your cervical health journey. Whether it's routine monitoring or more detailed examination, each step is designed to catch any issues early and keep you healthy. Always discuss your results and follow-up options with your healthcare provider, who can give you personalized advice based on your unique situation.